Hello, my name is Nancy Alvarez, and today I will be conducting my head-to-toe assessment for NURS612 Maryville University. He is my patient. I already asked him to empty his bladder. I did the vital signs, the height and the weight, and everything looked normal. Now I'm going to inspect the hand. The head size is normal. The shape is normal. It's symmetrical, both eyes. The eyes are symmetrical. The hair distribution is even. The texture is soft. And there is no scale, and there is no leaves noted. And the hair is not too dry and not too oily. Now we're going to palpate. The scalp is pink, mobile, free of lesions. There is a normal bone prominence, and I don't feel no depression of the scalp. I'm going to palpate both temporary arteries. They are equal. Now I'm going to listen for fluid. There is no fluid. Now I'm going to palpate the facial bones, the cheekbone, the mandibular, the maxilla, the nasal bone, the temporomandibular joint. Open your mouth, close your mouth, one side, another side, with your mouth open. Okay, the joints move free and there is no pain. Now I'm going to palpate the sinus. Do you have pain?
No.
Okay, the frontal and the maxillary are going to percuss. There is no lump and no pain noted. Now I'm going to test the facial muscles. Raise your eyebrow, close your eyes tightly. Now clench your teeth. Smile, stick your tongue out, and puff up your cheek. Okay, that also tests some cranial nerves. The patient is able to move all the muscles on his face. After that, I'm going to conduct a light test sensation. You tell me when you feel. You tell me now. Close your eyes.
No. 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 No.
Did you feel pain more in one side than another, or
No. Igual.
equal? Okay. Now we're going to inspect the eyes. I'm sorry. Your eyes look symmetrical. They are aligned with your ears. Your eyebrow and your eyelashes are free of scalp. There is no apparent lesion of the skin. Let me palpate your lacrimal apparatus. There is no tear and no exudated noted and no nodules. Close your eyes. I'm going to palpate your upper lid. There is no nodules noted. Now I'm going to inspect your conjunctiva. Open your eyes. Open your eyes. Look down. Look up, I'm sorry. Look down. Conjunctiva is pink, free of mucus, and the sclera is white. Close your eyes. Your eyes move symmetrically down and there is no tremors. Now I'm going to open your eyes. Now I'm going to move my pen and you follow the pen without moving your head. The eyes move together and smoothly. So now I'm going to do the test accommodation. Look at my finger and look at the wall behind. Look at my finger. Look at the wall behind. Look at my finger. I see that the pupils contract when the patient look at my fingers. Now I'm going to do the cover and uncover test. Could you please cover one eye and look at a fixed point in the wall? I see there is no movement and no tremor. Uncover your eyes. Uncover your eyes. There is no movement and no tremor on that eye. Cover this eye, please. Cover the other eye. There is no movement and no tremor, no wonder of the eye. Uncover. There is no movement, no tremors on that eye. Now I'm going to do the corneal light reflex. The light reflects in both points at the same point, in both eyes at the same point. That means that they are well aligned. Now we're going to inspect your pupils. Let me see. They contract directly, and the other eye contract consensual and simultaneously. Directly contract and consensual and simultaneously. You have a good pupil contraction. Both pupils are equal. Now I'm going to assess your visual field. I need you to see my nose, cover one eye, and tell me when you see my fingers.
No. 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 No.
Okay, now cover the other eye. Tell me when you see my finger.
No. 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 No.
That assesses the visual field. Now I'm going to inspect your ear. Your ears, the skin is intact, there is no visible mass. I see that are symmetrical. I'm going to palpate your auricular. There is no pain. You feel tenderness. No nodules.
No.
The mastoid bone is intact behind. Now I'm going to perform some tests. The first one is going to be the whisper test. I'm going to say one word and you're going to repeat it. Potato.
Potato.
Banana.
Banana.
Okay. Now I'm going to use my tuning fork and I'm going to put it in the middle of your skull, and you're going to tell me if you feel both equally or one side more than another one.
Equal.
Equal. Now I'm going to test the air and the bone conduction. You're going to tell me when you stop hearing each time.
No. No.
Okay. Now we're going to do it in the other ear.
No. No.
Okay. Now I'm going to inspect your nose. Your nose is symmetrical on both sides. There is no deviation, no deformity noted. It's a midline of your face. There is no apparent lesion noted. And cover please one nostril. And breathe in, breathe out. The other one. Breathe in, breathe out. The air moves free and there is no obstruction. Did you feel something obstructed? No. Now I'm going to inspect inside your nose. The mucosa is pink. There is a normal hair on both nostrils. The septum, there is no deviation, noted, no nodules, and your turbinates are light red and there is no discharge noted. Now we're going to inspect your lips. Your lips are symmetrical. There is no apparent mass, no nodules, they are pink, moist. I'm going to palpate. They are soft, no nodules noted. Bite down and bare your teeth. The jaw alignment is good because your upper teeth override your lower teeth. Now I'm going to inspect your mouth. Open your mouth. Open big, okay. The mucus is pink, moist. There is no apparent lesion noted. Your teeth are all aligned. Now your gums are pink. There is no swelling or no bleeding noted. Your hard palate is bony and well shaped, and your soft palate is muscular and pink. Now open again. Let me use this. Your uvula is a midline, pink, there is no lesion. Your tongue is symmetrical. Put your tongue up, please. Up. Okay. The ventral tongue is smooth, pink, and there is a small vein. And the dorsal tongue is kind of rough pink. Now move your tongue one side to another. Okay, I see no lump and no mass noted. Stick your tongue out, please. Okay, I see that the tongue is a midline, there is no tremors. Push your tongue against my blade. Okay, the other side. Okay, both sides are equal. Now say A. The soft palate move up, symmetrical, and the uvula is a midline. Now I'm going to test your gag reflex. Okay. Now I'm going to inspect your neck. Your neck, will you please? Your neck is able to sustain your head symmetrical. There is no mass noted. Now I'm going to check some range of motion. Move your head side to side now. Side, like this, side to side. Okay, and touch your, like that. Good. And now behind. Okay, the range of motion is good. Do you have any pain? No. The jugular vein are not, I don't see jugular distension here. Now I'm going to check, you have to shrink your shoulder again. The pressure that he does when he puts the shoulders up equally in both sides, equally strong the movement also. Now I'm going to check some, I'm going to palpate your nose. Okay, preauricular, postauricular, occipital, submental, submandibular, tonsillar, superficial cervical, deep cervical, posterior cervical, and supraclavicular, infraclavicular. Now I'm going to palpate your trachea. Your trachea is a midline. I'm going to touch your thyroid. Please tie that and swallow. Swallow. Good. And swallow again. Good. I'm going to palpate your trachea from behind. Swallow. swallow. There is no masses noted, no induration on the trachea. Now I'm going to palpate your carotid arteries. I'm going to auscultate. Could you please breathe in and hold it? Hold it. And the trachea. Now I'm going to inspect your arms, the shoulder, the hands. There is no mass, the capillary refill, the other arm. There is no mass, good capillary refill. Now put your arms straight. I'm going to push down and you keep it. Okay. Try to keep your good. Good. Now I'm going to assess your thorax. Relax. Breathe normally. The respiration is regular. I'm going to assess all aspects of your thorax. There is no accessory muscles. There is no difficulty breathing. He's not in distress. Now we're going to check for a turnaround. I'm going to inspect your respiratory expansion. Breathe in, breathe out, breathe in, breathe out. I'm going to check the tactile parameter. Say 99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
The vibrations are equal on both sides. Now I'm going to percuss. The posterior chest and also the lateral chest. The resonance is equal on both sides. Now I'm going to check your diaphragmatic excursion. Breathe in and breathe out and hold it. Hold it. Breathe in, breathe out, and breathe in and hold it in. Now the other side. Breathe in, breathe out, and hold it out. Breathe in and hold it in. Amazing. The diaphragmatic excursion is 4.5 centimeters, 4.5 are equal on both sides. Now I'm going to percuss your fingers. Tell me if you feel pain. Do you have pain? Okay. Finally, I'm going to auscultate your lung. Breathe in, breathe out through your mouth. In and out, please. In and out. In and out. In and out. Through your mouth, please. I'm going to auscultate on the lateral chest. Breathe in and breathe out. Now I'm going to assess the anterior chest. Please turn around. The bone and the muscular is good. There is no pulsations noted. I'm going to palpate. The infraclavicular nodes, the axillary nodes, like that. Axillary nodes. I'm going to assess for tactile premises. Say 99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
Okay. Now I'm going to percuss. Both lungs are equal. And finally I'm going to auscultate. Breathe in, breathe out. Breathe in and breathe out each time that I touch. Breathe in, breathe out. Okay, now lie down on the table. I'm going to touch the pericardium, feeling for thrills. I'm going to palpate the external clavicle, the pulmonic area, aortic area. I'm going to check for apical pulse. The pulse and the rhythm. Okay. Now we're going to hear the heart sounds, the aortic, pulmonic, air point, tricuspid, mitral. Now I'm going to hear with my pen for lower pitch, aortic valve, pulmonic valve, air point, tricuspid, and mitral. Now I'm going to assess the abdomen. The abdomen is symmetrical. The umbilicus is at midline and inverted. There is no apparent mass. I'm going to auscultate all quadrants started on the right. I'm going to listen for the pitch, the quality, and the frequency. With the bell of my stethoscope, I'm going to hear the aortic, the aorta, the renal, the iliac, there is no bruit, and the femoral. Now I'm going to percuss. I'm going to listen the liver borders. here. I'm going to, on the fan. Now I'm going to listen I'm going to percuss to see where the spleen is at. Okay, this area. Now I'm going to perform a light palpation. Tell me if you feel pain. I'm going to try to touch the liver border. Breathe in, breathe out, breathe deeply. Okay. I'm going to see. I feel it. Okay, here. Now I'm going to try to touch the spleen. Okay. And the kidneys. Okay. Let me perform a deep palpation. Okay. There is no mass. Now I'm going to inspect your legs. Your legs are symmetrical. The hair distribution is even. I'm going to palpate the popliteal pulse bilaterally. The dorsal. The dorsal. And the posterior tibial pulses. Both pulses are equal on both sides. Okay, take a seat. Okay, the muscles are well. Now I'm going to do the reflex. Relax in the knee and in the Achilles tendon, in the knee and in the Achilles tendon. And let me do your brachial reflex. Your brachial. Okay. Now push up your leg. Okay. Push down. Push back. Okay. I see that the strength is equal on both sides. Now stand up. Okay. Look at that. That way. The shoulders are symmetrical. So now try to touch your feet like this, or like try to touch your feet. The spinal is good. Okay, stand up. Now move one side and another side. One side like this. One side, another side. One side, another side. Back. And a little bit forward. Okay. Okay. I believe I did all your head to toe assessment. Oh, let me take your pulses. I'm going to check your brachial pulses. And radial. Brachial. And radial. Your capillary fin. Let's do it. And I believe that's everything. I'm going to conclude now my physical exam. And that's all. Thank you.